Next is the procedure for assessing fetal status, that we have to check the fetus, and there are various procedures which are done to check the fetal status, whether that is normal and abnormal or any disease process affecting on the fetus. So there are various procedures which are adopted during pregnancy or gestational period to assess the fetus well-being. It is a branch of medicine, so that to check the fetus status, the name is given perinatology. In this branch of the medicine, that is the perinatology. It is a branch of medicine that is concerned with well-being of fetus and neonates, covering the period from 26 weeks to 4 weeks after the birth. So this period extends parentology study because in early stages it is difficult to assess or to take the amniotic fluid or check it. So best period to assess any anomaly or anything is the 20 or various procedure to perform when the fetus become bit mature, 26 weeks to even 4 weeks after the birth. That is after birth, which is the fetus is assessed in the number one, the ultrasound examination, ultrasonography, which is very commonly used to assess the fetus well-being. This should be done during pregnancy to check the period of the growth or everything, give the lot of information about the fetus, cardiac activity, the growth of the femur, the crown and length increasing. So it lacks any adverse effect. There is many times people ask that repeated ultrasound may affect on the fetus. No, it lacks any adverse effects. It provide information about number one, chorionic sac, number two, placental size of the placenta, whether the placental growth is normal. Chorionic sac we assess whether its size is normal. Number three, placental shape, which is what is its shape? Abnormal presentation, that fetus is in abnormal position, like transverse lie or other. Biparietal diameter, we check the diameter of the head from parietal eminence. There are two eminences in the parietal bone, which is the wider part of the skull, and that is the diameter is taken. Fetal anomalies, next number 4, and number 5 is the biopsy of the fetal tissue, which is not commonly done, but this is also included in the ultrasonography, because under ultrasound guidance the needle is passed and take the biopsy of the fetal tissue. The needle is passed from the mother anterior abdominal wall, then through the uterus, then to approach the fetal parts and take the fetal tissue biopsy. Second procedure, which is invasive, ultrasound is non-invasive investigation. Second is invasive investigation, is in which you invade in the uterus, and the approach to the fetus is the diagnostic amniocentesis. Amniocentesis to take the amniotic fluid for the assessment of the fetus. That is procedure is known as amniocentesis. It is done between 15 to 18 weeks because amniotic fluid is less before that period up to 14 weeks. Its amount is less and difficult to draw. This is the earliest period between the 15 to 18 weeks, as early if you can. Uh, Amniotic fluid is sampled. Amniotic fluid is sampled 15 to 20 ml total. We take up, it give information about number one, chromosomal abnormalities. How we can check from fluid the chromosomal abnormalities? That is amniotic cell layer, amniotic layer cells that shed in the amniotic fluid, and we can collect those cells for DNA study or the chromosomal abnormalities. The carrier of the X-linked recessive disorder that can be checked from the cells in the amniotic fluid. Neural tube defects we can check by the level of the alpha fetoprotein in the, so that give information about the neural tube defect. Carrier of inborn error of metabolism, which is third procedure is alpha fetoprotein assay. It is synthesized in the liver of fetus, umbilical vesicle, and gut. Its level is high in its level is high alpha fetoprotein assay is the synthesized alpha fetoprotein is synthesized in the liver of fetus, umbilical vesicle, and gut intestine. Its level is high in amniotic fluid with the severe defect of the CNS and ventral body wall. Its level is lower in Down syndrome, and its level is high in with severe defect of CNS and ventral body wall, and its level is lower in Down syndrome. So that gives the assessment. Spectrophotometric studies. Examination of the amniotic fluid by this method is used. You analyze the amniotic fluid in this and assess the degree of erythroblastosis fetalis disease. Number 5 is the chorionic villus sampling. The villi which are formed from the fetal part of placenta, one can, under the ultrasound guidance, one can take the biopsy of the villi or trophoblastic tissue is taken for assessing the condition of fetus at risk. The fetal karyotyping can be done, and it is done at 10 to 12 weeks. Number 6 is the cell culture and chromosomal analysis. Chromosome aberration can be diagnosed. Number 7 is the fetal transfusion done in hemolytic disease of the newborn, can be treated by intrauterine blood transfusion. One can give in intrauterine to fetus, the blood transfusion can be given by passing needle into fetal peritoneal cavity or abdominal cavity and into umbilical vein. the two sites where the blood can be given, either directly into the abdominal cavity from where it is absorbed by the peritoneal vessels and into the umbilical vein directly. The fetoscopy using fibrotic instrument, external parts of the fetal body may be directly observed. It is done at 7 to 20 weeks. Number 9 is the percutaneous umbilical cord blood sampling. Blood taken from the umbilical vein and diagnosis of the IUGR, anemia, infection, that is, we can diagnose intrauterine growth retardation, anemia, infection, and aneuploidy. Number 10 is the MRI. It is done to plan fetal treatment. It does not have ionized radiation, so it is not uh, creating any danger to the fetus. Number 11 is the fetal monitoring, fetal heart rate monitoring, and oxygen of the fetus, that is fetal distress and maternal diseases one can diagnose.